Hello and welcome. When you think about heart disease, what comes to mind? For most of us, it's an invisible threat, something happening deep inside our chest, related to blood pressure numbers or cholesterol levels we get from a doctor. We think of it as a silent problem until it suddenly isn't. But what if I told you that your body has its own early warning system? What if the clues to unseen heart trouble weren't hidden at all, but were actually visible on the surface, on your skin, in your eyes, and even on your fingertips? Today, we are going on a journey to decode these messages. We're going to uncover the surprising and visible clues that can reveal the health of your heart. This knowledge isn't meant to scare you, it's meant to empower you. By learning to read your body's signals, you can become a proactive partner in your own health, potentially catching problems long before they become emergencies. First, a quick look inside. Before we look at the outside, let's briefly understand what's happening on the inside. Heart disease, or cardiovascular disease, is a broad term for conditions that affect the heart and blood vessels. The most common cause is something called atherosclerosis. Imagine the blood vessels throughout your body as a network of flexible pipes. In a healthy person, they are clear and open. But over time, a sticky substance made of fat, cholesterol, and other materials called plaque can build up inside them. This buildup makes the pipes narrower and stiffer, reducing the flow of oxygen-rich blood to all parts of your body, from your heart muscle itself to the tips of your toes. This single process, reduced blood flow, is the root cause of many of the visible signs we're about to discuss. A diagonal crease on your earlobe, Frank's sign. Let's start with a truly strange one. Take a look at your earlobes in the mirror. Do you see a diagonal crease or a wrinkle running from the ear canal towards the edge of the lobe? This is known as Frank's sign, named after the doctor who first noticed the connection in 1973. For decades, researchers have studied this sign, and a surprising number of studies have found a strong correlation between a diagonal earlobe crease and an increased risk of atherosclerosis and coronary artery disease. The exact reason isn't 100% confirmed, but the leading theory has to do with the loss of blood supply. The earlobe is full of tiny blood vessels. It's believed that the same process that causes plaque to clog the heart's arteries also causes a breakdown and collapse of the tiny blood vessels in the earlobe. This loss of circulation leads to the visible crease. It's a small, external sign of a much larger internal problem with blood flow.
Fatty, yellowish bumps on your skin, xanthomas. Have you ever seen small, soft, yellowish bumps on someone's eyelids, often near the inner corner of the eye? These are called xanthelasma. You might also see similar, larger fatty deposits, known as xanthomas, on the elbows, knees, or buttocks. These bumps are not just random skin blemishes. They are literal, visible deposits of cholesterol under the skin. This is one of the most direct signs on our list. When you have extremely high levels of bad cholesterol, LDL, in your blood, the excess cholesterol has to go somewhere. It gets deposited not only inside your artery walls, but also in other tissues, including your skin. Seeing these bumps is a powerful visual indicator that your cholesterol levels are dangerously high, which is a major risk factor for heart attacks and strokes. Swollen feet and ankles, edema. Many people experience swollen feet after a long day of standing, but we're talking about swelling, known medically as edema, that is persistent and leaves an indentation when you press on it. This type of swelling in the lower legs, ankles, and feet is a classic sign of a condition called congestive heart failure. Heart failure doesn't mean your heart has stopped working, but rather that it has become too weak to pump blood efficiently throughout the body. When the heart's pumping action is weak, blood can back up in the veins. Gravity then causes the fluid from these backed up blood vessels to leak into the surrounding tissues in the lowest parts of your body, your feet and legs, causing them to swell. It's a direct sign that your heart's pump is struggling. Clubbed fingernails. Look at your hands. Place the nails of your index fingers together, back to back. You should see a small, diamond-shaped window of light between them. If your fingertips are enlarged and your nails curve down so that this window is gone, it could be a sign of finger clubbing. Clubbing is a sign of chronic low oxygen levels in the blood. Over a long period, the body tries to compensate for the lack of oxygen by producing more growth factors, which causes the tissues in the extremities, like the fingertips, to enlarge and the nails to curve. While it can be a sign of lung disease, it is also strongly associated with heart infections and congenital heart defects that affect blood oxygen levels. A bluish tint to your skin or lips, cyanosis. This sign is more acute and urgent warning. Cyanosis is a bluish or purplish discoloration of the skin, lips, or nail beds. It's most noticeable in areas where the skin is thin. Why does this happen? It happens when there isn't enough oxygen in your red blood cells. Oxygen-rich blood is bright red, which gives healthy skin its pinkish tone. Blood that is low in oxygen is a darker bluish red. When this poorly oxygenated blood circulates near the skin's surface, it results in a blue tint. This is a clear signal that the heart and lungs are failing to deliver enough oxygen to the body, and it requires immediate medical evaluation.
A gray ring around your cornea, or corneal arcus. This next sign is in your eyes. Corneal arcus is a pale grayish-white or bluish ring that forms on the outer edge of your cornea, which is the clear dome-like outer layer of your eye. In older adults, this ring is common and considered a normal part of aging. However, if this ring appears in a person under the age of 45, it is known as arcus juvenilis and is a strong indicator of extremely high cholesterol and a significantly increased risk for heart disease. Just like xanthomas on the skin, this ring is a visible deposit of fats, specifically cholesterol, that have accumulated in the cornea. It's another external sign of a systemic issue with cholesterol management. Poor gum health. It might seem strange to link your mouth to your heart, but the connection is powerful and well established. Consistently swollen, red, tender, or bleeding gums are signs of periodontal or gum disease. Why does this happen? The link is believed to be inflammation. The bacteria that cause gum disease can trigger a constant, low-grade inflammatory response in your body. This same inflammation is a key driver of atherosclerosis, the process of plaque buildup in your arteries. The bacteria from your mouth can even enter the bloodstream and attach to the fatty plaques in your heart's blood vessels, worsening the condition. Taking care of your gums is, surprisingly, a way to take care of your heart. Sign number 8. Hair loss on your legs and toes. While hair loss on your head is common, losing the hair on your lower legs, feet, and toes can be a subtle sign of peripheral arterial disease, or PAD. This is a condition where the arteries that supply blood to your limbs have become narrowed by plaque. Hair follicles need a steady supply of oxygen and nutrients from the blood to grow. When circulation to the lower extremities is poor due to narrowed arteries, the hair follicles are starved of this supply and can no longer produce hair. Other signs of PAD include shiny skin on the legs and feet, sores that won't heal, and cramping in the calves when walking. Your action plan. What to do with this knowledge. Seeing one of these signs is not a reason to panic. Many have other less serious causes, but it is a reason to be curious and proactive. Observe your body. Take a few moments to really look at yourself. Get to know what's normal for you so you can recognize changes. Connect the dots. If you notice one of these signs, especially along with other risk factors like high blood pressure, diabetes, smoking, or a family history of heart disease, it's time to act. Consult your doctor. This is the most important step. Make an appointment and specifically mention the sign you've observed. Say, "I've noticed a crease in my earlobes and I've read it can be linked to heart health. Could we check my cardiovascular risk factors?" This gives your doctor a clear starting point. You are your own first responder. Your body is constantly communicating with you. These visible clues are its way of sending a message from the inside out. They are the check engine light on your personal dashboard. By learning to recognize a diagonal earlobe crease, fatty deposits on your skin, or changes in your nails and legs, you transform from a passive passenger into an active driver of your own health journey. You become your own first responder. Listen to the whispers, so you never have to hear the screams. Disclaimer. Please remember, the information in this video is for educational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you notice any of these signs, please consult with a qualified healthcare provider to understand their significance for your personal health. Thank you for watching. Stay informed, stay observant, and be well.